Thank you, Sahani sir and Patel sir. Good evening, good afternoon, and good morning. This is the 1494th day of continuous webinar conducted by International Forum for Promoting Homeopathy. All of you are welcome to the celebration of IFPH 1500 day celebration. Today is the first day of the celebration. Let us begin the session with a prayer from Dr. Hibert De Silva.
Thank you. Almighty Lord, we are passing through this exodus for last 1,500 days. It is an amazing day. God, you always, Almighty God, you always guided us through all these days. Never, this is not a man's plan. This is your plan, the Almighty God's plan. That is why all people from different parts of the world, all religions, all caste and creed came this platform and doing this wonderful experience for each and other. We know that this is not the plan of man. Throughout all these days, you guided us. We are very much thankful to you because in the first days of, while beginning these days, we never thought that it may prolong for all these days. Now, 1,500 days. And it may long forever, wherever, whenever, where to reach it. We don't know, but you know only, the Almighty God knows. Now we are surrendering you before you. Guide us and cleanse us from all evil things and cleanse the world, clear the world with your Holy Spirit and your greatness. Thank God we are surrendering you and guide us throughout all these days. Thank you, Lord.
Thank you, Dr. Hibbert. As you all know, the International Forum for Promoting Homeopathy has begun its journey some 1,493 days back, and it is going in full swing. We have 3 sessions every day, 7:30 to 8:30, the Hindi session, and 8:30 to 9:30, the international session in English, and 9:30 to 10:30, a local language session. We have homeopathic lovers, students, and doctors in this forum, so that the purpose of the International Forum for Promoting Homeopathy is to promote homeopathy among people who are not able to follow homeopathy, or those people who have no idea about what homeopathy can do for their health. And anyway, as you know, that we have arranged a 1 week celebration in connection with the 1,500-day celebration here. And the subject, we have chosen a subject for this purpose, and that the subject is scope of homeopathy for the diseases of human, animals, and plants, because we have presentations from different doctors and faculties on these aspects. And so we thought that this time we can dedicate this session to these 3 common things. So that's the beauty of the subject. And today we are lucky to have 3 great eminent personalities presenting their ideas on these things. And there will be an inauguration also. Dr. Subhash Singh, the director of the National Institute of Homeopathy, is the first faculty. Then the second one is Dr. Mridul Kumar Sahani Saab. And the third is, as you all know, that Dr. Kulwant Singh. And these are the eminent personalities presenting the today's session, and will be discussing about what the homeopathy can do in all these 3 cases. So let us welcome the guest of the day, our for inauguration, Dr. Subhash Singh. the Director of National Institute of Homeopathy. Mr. Hani, sir.
He's joining, sir. He's just trying to join. He's
Okay,
on the
sir.
way. Yeah, he's trying.
Okay, sir. Whether we shall begin the session with your presentation or Kulwant
Can you
presentation?
wait for 1 or 2 minutes, sir?
Oh, definitely.
Yeah, that will be better, sir.
Definitely, we can wait for
Because
one.
I have just talked to him. He said
Yes,
he's opening that.
yes, no problem, sir. We can go ahead with such discussions. And why we...
Hello, I've joined Dr.
Ah,
Sani, sir.
Yes, sir.
yeah, Dr. Subhash Singh has joined now.
Yes, sir.
So,
Yes, sir. I shall make... sir.
now you can start, sir. You can start, sir.
Yes, sir. Yes, sir. Let me introduce once again, sir. As you all know, the guest of the day, Dr. Subhash Singh, Director of National Institute of Homeopathy, is serving as the Director of the National Institute of Homeopathy and is involved in several research projects and has completed his MD in homeopathy as well as PhD in research in homeopathy, and he has presented more than 150 teachings in different parts of the world as well as in India, and he has won several laurels on his presentations nationally as well as internationally. So I'm not briefing about much. So let us proudly welcome Dr. Subhash Singh for the inauguration of the session, as well as sir can begin the presentation of the discussion. Welcome.
Dr. Dhanesh, kindly make Subir Bhattacharya the co-host, because Dr. Subhash Singh has joined by his name. Subir Bhattacharya.
Yes, sir.
You can see. Yeah.
Am I audible?
Yes, sir.
Yeah, you are audible, sir. You can start.
Thank you very much, Dr. Sani, and all the dignitaries and hosts who are here. It is a great occasion and a privilege for me to be a part of this grand program. As we know that this webinar has put us on the same platform, and somehow after COVID, it has become the need of the time. And this has made us help us in linking from all the people who are physically far away. But on this platform, we do link, we share our words and share our experiences. So thank you very much, organizers, for creating this wonderful platform where people from all over the world come and share their wisdom, their experience, and give us all an opportunity to learn. The topic that we are today discussing is the scope of homeopathy in animals, in humans, in animals, and in plants. You know, as far as the scope of homeopathy is in human is concerned, there is nothing much to say except that during this course of more than about 250 years, sometimes we got support of government, sometimes we didn't get support of government, sometimes we get encouragement, sometimes we get obstacle and opposition. This started from the time of Hahnemann. But in spite of that, homeopathy was able to survive. And homeopathy was able to survive because of one single fact, that it works. That it works and it gives relief to the suffering humanity. So those still today, there are opposition at different corners. But it's a fact also that many of the people who oppose, they also sometimes come to visit homeopathic doctor for their or their family members' treatment. So there cannot be a better evidence, there better fact of it in its support than this fact that it has acted for more than 250 years. And as far as it working on animals is concerned, the scope of homeopathy in animals has started with Dr. Boningerson. And there are many instances that if we turn the pages of our old journals or old books, there are many examples where homeopathy has acted on veterinary aspect, and there were physicians who have used homeopathy. I come from, nowadays I am working in Bengal, but I originally come from Bihar. And in Bihar, I have seen homeopathic physicians in very deep rural areas. They have used homeopathic medicine for animals. And as far as plants are concerned, it has been my privilege that while I have been guide to many of the students, and one of them I recall was Dr. Virendra from Hyderabad. And I have seen with homeopathic medicine, he has grown a sugarcane to the height of 18 feet. And he has also, when I went to a village, my village, he advised me to use sarasena in the cows, which increases the milk output. And I have used it personally and have seen it working. So there is ample scope of use of homeopathy in animals. There is ample scope for use of homeopathy in plants, whether it is our home plants or it is agriculture. There is much to be explored in this area. So I'm sure today we are going to discuss its scope, and I'm also sure that this platform will create awareness and create a platform where people will explore its use in other aspects also. So I wish all the best, and I wish this once more to the host. I want to acknowledge their service that they are rendering, and I am sure this will continue for a long time to come. And my respect to Dr. Sahni. Thank you, sir, for having me here. And at the same time, I will also request Dr. Sahni to please excuse me because there is another meeting, official meeting, which I am supposed to attend at 8:30. So
That's great,
please.
sir. But before you leave, sir, you just inaugurate this meeting.
I hereby, it is my privilege. Yeah. It is my privilege and honor to officially inaugurate this webinar and wish all the best to all the concerned here. Thank you very much.
Can you wait for 5 minutes or more?
I will, sir, definitely.
Yes, thank you, sir.
Thank you, sir, for an excellent inauguration of International Forum for Promoting Homeopathy's 1,500 day celebration, day 1. Now let us invite our guest, none other than our the chairman of the scientific committee, as well as the chief coordinator of IFPH, Dr. M.K. Sahani sir, for sir presentation on this evening. Welcome, sir.
Thank you. Thank you, Dr. Dhanesh. Good evening, friends. Today, on the occasion of first day of Sardiya Navratra, Durga Puja, Kalas Sthapna Puja celebrations, which is also coinciding with the initiation of IFPH celebration of 1500 completion of daily webinar in English language. It is a resemblance of a spirit of optimism for nature. I take this opportunity to congratulate all and wish this journey of continued learning program reaches to the infinity. I am glad young, inspiring Dr. Subhash Singh, in the spirit of carrying the torchlight of learning, inaugurates this occasion. Treasured wisdom and enthusiasm in homeopathy has brought him to the level of his present position as director of the prestigious institution's National Institute of Homeopathy. NIH has become a symbol of truth and reality in homeopathy. I wish many more success in his life to maintain the legacy of his father as well as the homeopathy. Now, while I present to start my session and talking about my subject for today's presentation, I am reminded with the following message, which is most relevant in the spirit of imbibing the the spirit of essence, eternal science of medicines as expressed through the homeopathy. Flourishing extends as far as understanding, and those who truly understand more truly flourish, not as a mere accident, but through the excellence of their understanding. This was the quote from Aristotle in his Ethics. Throughout the history of the medicines, there have been numerous instances where individuals made significant discoveries but failed to present them in a scientifically acceptable manner or inwardly provoked opposition from the medical establishment. As a result, the benefits of these discoveries were either delayed or entirely lost to humanity. While this offers potentially valuable insight that could improve public health, it risks being overlooked by the biomedical communities due to the academic weakness. Criticism of the medical establishment and perceived challenges in the pharmaceuticals industry. Additionally, the prevalence of other diseases and other many influence this the issue under discussions also should be explored. Throughout the history of doctors and healers have continuously built up upon the knowledge passed through from previous generation to the present time. Different therapeutics methods were discovered and have been reached regarding the medical practice as the modern scientific medicines of the day. Humanity has endured countless natural and social disasters and managed to survive, demonstrating that medical knowledge was never entirely erroneous or ineffective. However, as modern medicines become more specialized, it lost its holistic perspective of health, illness, and treatment approaches. Many effective methods from traditional medicines have been forgotten or excluded from the mainstream practice. It would be beneficial for contemporary medical educations to integrate the broader knowledge of historically proven therapeutic methods and analyze practical cases. Medical study should also be taught to evaluate the effectiveness of the treatment methods regardless of when it was discovered, while always keeping in mind core principle of a medicines. I will use treatment to help the sick according to my ability and judgment. This is the Hippocratic oath that every physician take. Now, the materialistic medicines, medical science has remained exploring in the limited of its own limitations, dimensions which has always been backward. Looking beyond the materialistic world also have been made by several scientists around the world, but were confined to keep within the scope of specific purposes. Attempts were done with a myopic vision. Man as a whole has its extension which needs to unify material and spirituality. It is only possible when we learn to have a wider vision in the holistic manner. The beautiful things we can understand, wonders of the today proves to be the rubbish for tomorrow. History speaks of the materialistic discoveries which were delusioned as the wonders were thrown into the rubbish basket. It speaks of the transient nature of progress, innovation, and discovery. It highlights how what seems extraordinary on or groundbreaking at one point may later be surpassed or rendered obsolete by the new advancement. And this is not true with the homeopathy, because it is based on the natural system of the medicines. Looking beyond the materialistic world also have been made by several scientists around the world, but were confined to the keep within the scope of a specific purpose. Materialistic attempts were made with myopic vision. Whereas man as a whole has its extension which needs to unify material and its spirituality. It is only possible when we learn to have a wider vision in holistic manner. Looking beyond the materialistic world also have been made several scientists, Dr. Henneman, with his continued investigations, kept on revisiting, revising, and updating, which has enabled to make homeopathy as a complete system of the medicines. Researchers in medicines where humanity is involved needs to have a different approaches rather than looking through the body, physical body problem only. As two individuals are not alike and is different but unique individual needs an outline with changing patterns where there is a guiding principle. Man is represented by his mind, body, and central point of his spiritual life. It is possible with case series studies as a man in disease. Both mind and body have the following guiding principles of individuals' vital principle. Every new individual born is a new equation from the same set of the elements. It makes us a unique, incomparable phenomena. Friends, different type of disease keeps on invading the humanity with the same set of symptoms but aligned in different equations. Researches were conducted by the nomenclature of disease will always have limited access leading to the palliative mode of treatment. Keeping man in central point requires understanding holistic approach. Recognition of spiritual being brings understanding of the life of an individual who is different from each other, yet having the same materialistic physical plane. When spirituality is involved, it also requires to have the type and nature of the medicines. Then real life impact is understanding the life in health and the disease that is physical, mental, and the spiritual. Homeopathy represents the meeting point of materialism with spirituality. Dr. Henneman represents a paradigm shift in history of medicines. The life of legacy of Dr. Henneman, highlighting his early years, pioneering research and significant impact on medicines. From his formative years in medicine to his revolutionary work and lasting influence, Dr. Henneman's story is one of the intellectual courage and compassionate innovations, illuminating a path that continues to inspire and heal today. Dr. Henneman recognized the nature of the medicines which has to be brought to the level of spirituality. In the present scenario of materialistic medicines, homeopathy has remained a debatable subject. In the current context, homeopathy faces significant challenge in defending its core principle. These challenges in homeopathic research has been categorized. Now let us see some of the challenges that is prevalent today. The challenges in homeopathic research. One is the conceptual challenges. Difference in the conceptual image between the homeopathy, the conventional medicines. There are differences, particularly is the understanding of disease and their treatment poses a difficulty for the research. Second point is the methodological challenges. Issues such as weak study design, inappropriate outcome measures, lack of statistical knowledge, and poor adherence to homeopathic principle, which results in incorrectly remedy selections, complicate the research efforts. Third point is the logistic challenges. The absence of well-trained homeopathic practitioner in both homeopathic principle and research methodology, along with the inadequate infrastructure, lead to the limitations like restricted access to relevant research, literature, and resources. Then next point is research culture. The hesitations within the homeopathic community is fully embrace research as part of its practice present an additional hurdle. Then another greatest problem is the potency problem. Above all, the greatest challenges lie in the fact that beyond Avogadro's number, what remains in the homeopathic medicines and how it works. Then administration route, how the medicines are administered, this immaterial medicines, the vital medicines to be administered to the patient. Among the greatest challenges facing humanity is the ability to survive and the progress. Beautiful quote by Patrick Denin. Meeting the challenges, meeting of these challenges, to address these challenges, several measures have been proposed, including enhancing research, educations within the homeopathic community, enduring strict adherence to the principle, homeopathic principle, applying appropriate research methodology, fostering interdisciplinary communications and encouraging collaborations among educators, researchers, and practitioners, and improving documentation practice is also recommended to raise the research quality. So this is the enhancing research in educations within the homeopathic community, ensuring strict adherence to the homeopathic principle is necessary, applying appropriate research methodology is necessary, and fostering interdisciplinary communications and encouraging collaborations among educators, researchers, and practitioners, and improving the documentation practice is also recommended to raise the research issue. Now, against all odds, there is a hope, the persistent popularity of homeopathy. Homeopathy remains widely popular, but popularity alone does not determine its validity in scientific discussion. In reality, the principle behind homeopathy contradicts fundamental natural law. It lacks explanatory power and fails to meet the standard of scientific approach. Two recent large-scale studies have shown that despite numerous clinical trials, there is no evidence that homeopathic remedies have any therapeutic effect beyond the placebo. So in spite of the popularity, the patient community has accepted it, but it has to be accepted by the scientific community also. The continued success of homeopathy is largely due to the lenient regulations, limited scientific literacy, and insufficient health educations. While regulatory changes may be underway, improving public health education is likely more critical to inform decision-making patients. Without this, the idea of a responsible patient making informed medical choice remains a more legal formality of the reality. So homeopathy is the true and very advanced science, much beyond the scope of current method of chemical analysis and interpretations. This is a very beautiful quote from Dr. Aditya Sardana. So just to conclude with this, just my humble presentations, I wish to find some thoughts within all. Thank you very much for your patience and listening. Thank you very much.
Thank you, Sahanisa, for such a beautiful session in this evening. To begin our session, and this is something great, that homeopathy is the future of medicine. And that's why we say homeopathy is the medicine for the millennium. And now, let us invite the guest of the day, Professor Dr. Kulwant Singh. As you all know, sir has an MD holder and has worked as a reputed practitioner from Steel City of Jamshedpur, and has served as homeopathy and is still in practice, serving an educational researcher and clinician. He served as a dean and faculty of homeopathy, Vinoba Bhave University, Hyderabad and Jharkhand. Sir was the former principal, Zingham Homeopathic Medical College and Hospital, Jamshedpur, since 2000 onwards. And so sir has presented various papers nationally as well as internationally, and has won laurels from many of the world's greatest homeopaths. And let us proudly welcome our guest of the day, Kulwant Singh, sir.
Before he starts, I will say something about Dr. Kulwant Singh also. Dr. Kulwant Singh was not able to participate in our webinar for a long time, I think more than 5 to 6 months because of his seriousness. Now he has regained his health, and he is so vigorous in presenting the lectures that he asked me, and I am very happy that he has returned back to continue his efforts in the medicine. Now, let us welcome Dr. Kulwant Singh, sir. You can start, sir.
Thank you all. First of all,
Yes, sir.
I would like to congratulate the IFPH team who has been. We say that we congratulate, you are doing a very good work, but I can understand that what you are doing. Since long time, tirelessly, you are propagating the cause of homeopathy. I give my salute to all your team who are doing such a nice work. And one more thing, to just safeguard me, I would like to inform you that Dr. Sahani rang me day before yesterday only. And he told me that you have to present a small seminar. So I got only 24 hours to prepare this presentation. So I would like to apologize if I have some mistakes or something which was not very good up to the level of standard of IFPH, but I will try to do my best, and let us start the presentation. So today I have been asked to present the scope of homeopathy for the diseases of humans, animals, and plants. My humble request is that the diseases of humans we have been discussing since a very long time, few years, and Dr. Sahani has discussed so many nice things in his presentation about the humans. What I will do in very short is a small comparison between the treatment of human, animals, and plants. We see that these things, the cause of disease in all of the genus is mysomes. So there is Sora, syphilis, and psychosis. You will see great similarity in the mathematic symptomatology of human, animal, and plant. You can see that Sora in human, it causes skin and respiratory complaints, dry itching, skin eczema, asthma. The same manner in animals also, this causes skin rashes, itching, scabbing, digestive upset, and in plants, how they will express the itching part. So itching part is expressed by leaves scorching. I show you the pictures of yellowing of fluorescence and stunting. These three are the symptoms, objective symptoms which we can observe, and they are signs of Sora. Basically, itching from within. And animals, of course, we can mark and we can see the rashes and itching, scabbing, digestive. In case of syphilis, myasm, in humans, we see degenerative diseases, mental disorders, ulcers, dementia, and paralysis. And in animals, especially in animals, I've been watching so many animals, patients. My friends, sometimes they ask me to prescribe for their pets. Especially, I have been prescribing several medicines to the dogs, pet dogs, and it acts wonderfully on the pet dogs. Sometimes, yes, previously where I was living, that was an area with lot of cow and buffaloes. We say the Gwalapattis. So some of them used to come to me for their problems of cows and buffaloes, and I used to prescribe and with miraculous results. But the thing happened that I have to stop it because there came a time when I was seeing consulted for more animals than humans. So then I stopped practicing veterinary practice. But the thing is that in case of syphilitic miasm, in case of animals, you will see joint pains, neurological symptoms. You will see in dogs, it is very prominent. The neurological symptoms and vision problem. Vision problem, you will see so many of the people will consult you that my dog is not able to see. So vision problems are a keynote for syphilitic miasm in animals. And in plants, there is systematic wilting. I'll show you what is systematic wilting. Actually, the systemic wilting is the plant starts losing water. And due to losing water, they dry and die. Yellowing also is the same thing. There is actually yellowing, it becomes sign of lack of chlorophyll. So if there is lack of chlorophyll, there is yellowing sign, the leaves become yellow and distorted growth. If there is syphilitic miasm, of course, there will be distortion of the growth of the plant. I have a small farmhouse with several types of vegetables where we are doing organic farming. I'll come to that how homeopathy has helped me in managing my farming also. It is a practical experience. And next part is psychosis. You can see the psychotic part. In case of humans, there is chronic inflammation and growth. In case of animals, urinary tract infection, ear infection, respiratory issues. And fungal infections, root rot. Root rot is a condition when the plant's root deteriorate. And they deteriorate due to the lack of oxygen. I'll show you the picture also. So these are the basic signs of miasmatic symptoms in human, in animal, and in plants. If we can understand this, we will be able to treat. There are a lot of research is going on, especially the action of homeopathy on plants, and which is becoming very productive. The results are very encouraging. More specifically, I would like to show you what are the basic medicines. So when we know that when there is thoracic miasm, the best medicines are sulfur, sorinum, calcarea carb, and lycopodium. That we know. In animals, sulfur, sorinum, calcarea carb. In plants, it is sulfur, calcarea carb, and no. So you see, we are having almost similar medicines. So there is not much of a difference in treating human, animal, and plant. The syphilitic miasm is having the Merck's medicine, Merck's salt, syphilidum, auramate. In case of animals, there is Merck's salt, and there is, in case of plants, there is sulfur. And Merck's salt also I have forgotten to write. And in case of psychotic miasm, in case of humans, Thuja, animals is Thuja, plants is Thuja. So these are a very basic concept that what are the basic anti-miasmatic medicines to treat all three, humans, animals, and plants. I would like to discuss some animal medicine, especially from the dogs and cows and buffaloes, because we cannot discuss in a very 15 minutes, we can't discuss all these things. But in case of dog, and you will be getting so many animal patients like this. Common bone and joint pain are a great keynote for a dog disease. They very frequently suffer, and you will see a pet is coming to you, or you can see a pet which is not able to move properly. He is walking and falling down, walking and falling down. This is due to arthritic symptoms. So there is problem in the joint, there is problem in the shoulder, there is problem in the elbow, there is problem in the carpus, knees and hip. So all these things which a human also may suffer. And very surprisingly, all the medicines are same. The medicines which we give for arthritis, few humans, Rustux, Brownia, Ruta, Arnica, Belladonna. I would like to give you an example. My daughter lives in US and she's having a very beautiful pet dog. So once she rang me that, Daddy, my dog is not able to walk. He is falling down and some of his joints are swollen. And surprisingly, I just asked her to give Belladonna and Rustux. Belladonna and Rustux 3 times a day, 20 drops daily in one dose. And miraculously, the dog became better within 10 days. After 10 days, there was no swelling, pain was there, and they continued with Rustux for 1 month, and the dog became all right. This is the example, my personal experience in the treatment of dog by homeopathy. So if the dog is suffering from joint pains, arthritis, especially in these areas, so these are the medicines which will always help you. Please keep it in mind. People will come you for consultation. Rustux, Brania, Ruta. Of course, we know the symptoms. The best part is that in treating animals and plants, the most honest results are there because subjective symptoms are very few. So the patient cannot lie. Patient cannot express wrongly. All what you see are the proper, honest result of a homeopathic medicine. Even in plants, they can't speak. But for the diseases of plant, if you give some medicine and there are results, it itself a proof that homeopathy is working. Our time is coming. And the way the veterinary doctor, you also must be having so many known people. The veterinary doctors are now prescribing homeopathic medicine and sometimes taking our help also. Because they accept that homeopathic medicines are working beautifully on animals. So second most common problem in case of dogs, cats, and especially big animals, cow, buffalo, in all. The medicines are excessive itching. And when there is excessive itching, you will see that dog is licking in that area. You just clean that area. There is scratching, there is bad skin odor, there are red patches, hair loss, and the common problems, of course, are there. There are allergies, there are seborrhea, bacterial infections, fungal infections. All these problems I am showing you in a dog, but all these problems can happen in cow, in buffalo, in cats, and other animals also. But normally, we are treating pet animals. So these 4 are the most common pet animals. And the medicines, sulfur, arsenic album, oleander, and graphitis. I would like to just give you a reminder that never forget oleander in case of itching of the dogs. It works like a miracle, oleander. We are giving oleander especially in case of dandruff on the scalp. So the dog is having hairy part all over the body. So hairy parts when having itching, scaby rashes, sometimes oozing is there. You can take help of oleander. Occasionally, intercurrently, graphitis will be helpful. I have been very successful in treating these kind of cases. Next, the most common diseases of dog, which you will find, you can see there is diarrhea. So medicines are arsenic, podo, naxomica. There is vomiting sometimes, not always. Dogs do not suffer with severe vomiting, but there are epica, nuts, and phosphorus. Please see that all medicines are very similar, which we give to humans. If the dog is very fearful, obviously aconite, argentum nitricum, and gelsemia. Sometimes you will see the cat becomes very fearful, don't want to go to anywhere, just go to a corner of the sofa, corner of the bed. So at that time, you can prescribe these medicines with good results. Ear infection is a very common thing in animals, especially the pet animals, cats and dogs. So they get very commonly ear infections because the ears are not properly cleaned always. And the medicines are pulsatilla, Hipersulf, and Palatia, depending on the symptoms. And symptoms as per mathematics. This is a very common problem of dogs. It is when some dogs are suffering from regular cough. So if there is a regular cough in a dog, please, it is always known as kennel's cough. The doctor will prescribe that it is diagnose that it is kennel's cough. So for kennel's cough, the best medicine is Drosera. The other two are Spongia and Aconite. But the best medicine, if a dog is complaining of severe cough, the person will come and tell you that my dog is severely coughing since 1 month. No medicine is helping. We have given all kinds of medicine. Drosera is almost specific for such problem. Urinary tract infection is also very common in pets. Cantharis apis sarsaparilla. If the dog is crying at the time of urination, sarsaparilla will help. Cantharis may be help. No question, if there is a wound, arnica, candula, hypericum. The dogs most commonly suffer with allergies a lot. Very common allergies. Itching allergies, they get very common. So that allergy is having apis and histamine. And there is one more disease, which is canine distemper. Canine distemper is very common problem when a dog is having, cat is having severe cough with a lot of congestion. You can feel the congestion when you will put your hand or stethoscope, you will be able to feel the congestion in your chest. And our miracle medicine in this case is Antimtat. So never forget that two diseases which are very specific to dog, kennel's cough, Drosera, canine distemper, and Antimtat. Now come to the cows and buffaloes part. So the most common problem which whoever is having an experience of living in a village or going to a village, this is the most common problem in cows and buffaloes, mastitis. The owner will come to you that there is a swelling here, there's severe pain, the cow or buffalo, they may get fever also, they can't be able to give milk, and the best medicine as per homeopathic symptomatology is belladonna and phytoleptin. That will give you miraculous result. You will be surprised at how these medicines work on mastitis. And mastitis is one of the most common problems you will face in case of cows and buffaloes. And sometimes there is lack of milk. Patient will come, owner will come to you that she has delivered and after delivery, the milk is not coming properly. In human also we give Artica urine, and Artica urine also is helpful in case when there is lack of milk. Skin disease and itching. I already told you, hairy animals, so oleander is one of the best. And one very common problem is aphthous. You will see the animal will not be able to chew the food and there will be severe salivation. And in that case, just look into the mouth there will be aphthous stomatitis, and hydrostasis is the best method. Occasionally, Merxol also helps, but hydrostasis is very good. And one very serious condition in case of cows and buffalo sometimes is there that after delivery there is septicemia. And if there is that condition, septicemic condition in cows or buffalo, the best medicine is Bothrops, not pyrogen, not other. The only medicine which works is Bothrops. In case of worms, they can give colchicum and silesia. If delayed delivery, this is also very common. Patient owner will come that the cow is not able to deliver. Very, very common problem. And see, the best medicine which we prescribe also in human also, that the medicine is pulsatilla. Facial seizure is also a medicine which will be used. Facial seizure you will very commonly get in animals. There is severe cramping sensation in face, and these cramps will be visible. So Mygale is one of the best medicines. And of course, there is diarrhea, sulfur, and podophyllum. These are the two medicines which will be helpful to you. Now, we shall discuss something about the plant. And while starting discussing for the plant, I will like to give great homage to this personality who was Dr. Jagdish Chandra Bose. Because Dr. Jagdish Chandra Bose made groundbreaking discoveries showing that plants have life. The plants can feel pain. They exhibit responses to external stimuli similar to animals. This he documented in year 1901. So before 1901, we were not sure that the plants also have life. So in 1901, he proved by his experiments that plants are like humans. They can feel heat. Very strange, miracle. They can feel pain. They have life. Their cells and human cells are very similar. Whoever read biology, the plant cells and animal cells have great similarity. They exhibit responses to external stimuli. We may not notice, but if we watch carefully and we watch by one machine which he invented was known as cresograph. So this machine, cresograph, was able to magnify plant responses to stimuli up to 10,000 times. So with this machine, he was able to measure the response of the plant against any external stimulus. So we must be thankful and grateful to Dr. Jagdish Chandra Bose. The whole humanity is thankful to him, but especially the homeopaths, because after coming to know that the plants have life, we started experimenting on plants. That they are not having very, very subjective symptoms, but there are so many things which can help us to guide the selection of medicines and curing the diseases in plants. He showed that they have a nervous system that they can feel, they can respond and grow dynamically in reaction to their environment. And there is a term plant fatigue. When continuously stimulated, plants would become less responsive, like us. When humans are fatigued, we are completely fatigued with a lot of work. So we are not able to work properly, not be able to respond properly. So that is known as plant fatigue in case of vegetable kingdom. He proved that plants have a memory, and plants could retain memories of previous stimuli. See, we did not think about this, that the plants had memories and they can take again to these memories back whenever they need it. Plant responses to external stimuli. And there is plant neurobiology, a field which was able to establish that a field that explores how plants process information from their environment, similar to how nervous system operate in animals. And both also discovered that plants, when wounded or damaged, exhibit electrical response and a release of vital energy. This is what homeopathy is. And this was proved. All these things have been proved by late great Dr. Jagdish Chandra Bose. Till now, we were only knowing that, yes, Dr. Jagdish Chandra Bose was a great scientist, and he invented that, yes, plants also have life. That's all. But we see his creations, see his inventions, and these are the inventions on the base of which we can prescribe our medicine. Come to some very common diseases of plants. You can see, and everybody must have seen these problems. You can see this white fungus on the leaves. You must have seen, all of us have seen. So while gardening, in house, in farm, I have been giving this Azadirachta mother teacher solution to all my plants in my farm. Neem solution, neem patta solution. You must be knowing neem. It is a great antifungal medicine. So I have been giving this mixed with calendula mother tincture, and we spray the calendula and neem mother tincture mixed with water on the plants, and hopefully maximum fungal infections are not there. So this is a fungal infection. For this, the best medicine is acid nitric and Azadirachta. Azadirachta is the neem plant. Next is brown spot with fungus. This kind
Sir, we have to finish the session in
okay,
2
2
minutes.
minutes.
Yes, sir, only 2 minutes, sir. So we
Okay.
can make a big presentation of the subject late
This is the
in the
last
next
slide.
week.
This is
Yes,
the
sir.
last slide. So there
Okay,
are,
sir.
if there are brown spots, belladonna. If yellow leaves, Yupra metallicum. If there is stunted growth, you can see this is the normal logo, this is stunted growth, then Silesia. These kind of powdery mildew, then acid nitric and sulfur. If there is root rot, the root decay is there, then phosphorus and arsenic album. If the brown spots, CPR. Damping of the root decay, the plants decay due to lack of water, then medicine is Calcaria and Silesia. And in potato, this is the most common infection, blight potato. You must have seen these kind of potatoes. The medicine is Bacillus thuringi. And there is mealybug. You can see these are the mealybug in the plant. The best medicine is thuringi. This was just an introduction, a very small introduction, at how these medicines are working on plants and animals. Thank you very much.
Thank you, Kulwant Singh, sir. It's a very, very interesting and very, very futile, very excellent presentation on the part of using how the homeopathy works in all these conditions. And we hope that there are so many questions from different part people. Anyway, we need a full presentation of your session in the coming month itself, as per your convenience.
Yes,
so
I'll
that
be speaking on hypertension.
yes, sir. We can those people want to clear their doubt can clear the things in the coming edition. So it is the time to wind up the session. I invite Dr. Mariam Salceda from Bolivia to say auto thanks to the session. Dr. Mariam, please unmute yourself. Please unmute. Please unmute.
Thank you, Dr. Ganesh. Good evening to all of you. Excellent presentation, really a feast for our ears and the mind with brilliant information that you have shared with us. Thank you, Dr. Sahaniji, for showing us the greatness of homeopathy and also showing us the challenge that we face every day in practice and all of us as practitioners of this science. Without a doubt, if we continue working in this line of sharing, we will be able to contribute to the development of homeopathy. With scientific and technological progress, at some point we will be able to deeply understand the mechanism of action of our medicines. Now we have the evidence of the effectiveness in each cured case. I want to thank Dr. Singh for this wonderful tour of the animal world, the common problems and the remedies to keep in mind. Excellent presentation. So thank you very much. And a special thanks to IFPH meeting for making it possible. So we hope on more sessions. Thanks for this hard work for 1,500 days. And we will hope there will be many, many, many more days. Thank you, all of you, for your assistance. Thanks, Dr. Daneshi.
Thank you, Dr. Maria Salceda. Thank you, Dr. Subhash Singh. Thank you, Dr. Kullan Singh. Thank you, Sahani Sir, and those who participated in the session. And tomorrow, we will have a session from 3 different people, and they are Dr. Nikunj Trivedi, Dr. Girish Gupta, and Dr. Shaji Kudiyat. And the subject will be the same: scope of homeopathy for diseases of humans, animals, and plants. Hope all of you will be with us tomorrow at the same time. Thank you all. Good night. It's over to Dr. Manoj to moderate the Malayalam session.